Hello friends, and welcome to our today's lecture on cardiomyopathy. It is a new topic and we will cover it in 2 or 3 lectures. So today we will start the topic by just first a brief introduction about the naming. So what is cardiomyopathy? So basically, as you can see that the word cardiomyopathy is made up of 3 words, that is cardio, myo and pathy. Cardio means obviously heart, myo means muscle, you know, and pathy means disease or suffering. This you already know. So, uh, so what does that mean? Cardiomyopathy. So, cardiomyopathy means disease of heart muscles. So, after learning the name, we will look at classification. So, like most of the other diseases, it is also classified as primary cardiomyopathy and secondary cardiomyopathy. In primary cardiomyopathy, the cause is not known, and in secondary cardiomyopathy, the cause is known. Basically, when someone says cardiomyopathy, it is implied that he is speaking about primary cardiomyopathy, because secondary cardiomyopathies have their specific names. But nowadays it is not clear, because some authors are using cardiomyopathy for both primary and secondary type. So it is better to start by classifying cardiomyopathy as primary and secondary. So as you can see from name, that primary means it is derived from first, and secondary is second. So why it is called as primary? Because the cause is not known. So you can say that the disease itself is a first event. No event is there which is before that and which causes it, which happens in secondary cardiomyopathy. Because secondary means it is second to something. Yeah, that means something has happened earlier, and this cardiomyopathy is second to that thing. So it is called as secondary cardiomyopathy. So basically, primary cardiomyopathy also have some cause, but as of now we don't know those causes. So we classify them as primary. But as we are coming to know their causes, they will be termed also as secondary cardiomyopathy. So basically these are two classification, primary and secondary. Now there is sub classification of primary cardiomyopathy. So primary cardiomyopathy is divided into further 3 subtypes, that is idiopathic dilated, idiopathic hypertrophic and idiopathic restrictive. First one is idiopathic dilated, second idiopathic hypertrophic, and third one is idiopathic restrictive. And further there are subtypes of idiopathic hypertrophic and idiopathic restrictive. So what are the subtypes of idiopathic hypertrophic? It may be obstructive type and non-obstructive type. And subtypes of idiopathic restrictive cardiomyopathy are cardiac amyloidosis, endocardial fibroelastosis, endomyocardial fibrosis, Loeffler's endocarditis, and there are some other forms also. So this is subclassification of primary cardiomyopathy. It is subclassification of primary cardiomyopathy. So till now we have learned about naming of the disease, then classification, and then subclassification. Now we will look at primary cardiomyopathy in detail. So as you already know that primary cardiomyopathy has 3 subtypes, that is idiopathic dilated, idiopathic hypertrophic, and idiopathic restrictive. So we will study all these 3 one by one. So first of all we will study about idiopathic dilated cardiomyopathy. So idiopathic dilated cardiomyopathy is also known as idiopathic congestive cardiomyopathy. From the name you can see that the name given is dilated. So it implies that the heart is dilated. Dilatation of heart means dilatation of its chambers. So how many chambers are dilated? All the 4 chambers of the heart are dilated in idiopathic dilated cardiomyopathy. Remember this, all the 4 chambers are dilated, not 1, not 2, not 3, but all the 4 chambers of the heart are dilated. And due to this dilatation, what happens is heart is unable to pump blood to body effectively. So some part of the blood is remain behind in heart. So this that causes congestion in heart. So it is also called as congestive cardiomyopathy. And due to this loss of function of heart, what is it is called as it will lead to gradual and progressive cardiac failure. Okay. Now coming to etiology of idiopathic dilated cardiomyopathy. First of all, idiopathic. Idiopathic means something of which cause is not known is called as idiopathic. And now we will look at etiology of dilated cardiomyopathy. So as you can see that we have already talked that it is idiopathic. So how we will know about its causes? So this actually its causes are unknown, but following are some hypotheses which are proposed. They are only proposed, they are not proven. So we will look about what may be possible causes of dilated cardiomyopathy. Viral they are viral myocarditis, toxic damage from cobalt and chemotherapy, inherited mutations, chronic alcoholism, and post delivery or peripartum. So these conditions are seen in patients who have dilated cardiomyopathy. So so it implies that there may be some connection between this condition and dilated cardiomyopathy. So these may be possible or probable causes of dilated cardiomyopathy, but not confirmed till now. Viral first one is viral myocarditis. So in patients who have viral infection of myocardium, viral myocarditis means viral infection of myocardium. In patients having viral infection of myocardium, dilated hypertrophy is seen. Similarly, in people having toxic damage from cobalt and chemotherapy, or also seen they are seen with dilated cardiomyopathy. And there may be some role of inherited mutations. Mutations means change in structure of gene, and when this gene is inherited from parents to their offspring, it is called as inherited mutation. So because there is some familial connection, it is seen in it runs in families. So it is thought that there may be some family connection. Similarly, in patients of chronic alcoholism, dilated cardiomyopathy is seen. And sometimes after delivery, woman experiences dilated cardiomyopathy, that is called as peripartum dilated cardiomyopathy. So these are probable causes. And now we will look at morphologic features. Morphologic features of idiopathic dilated cardiomyopathy. So as you know, morphologic features are divided in gross and microscopic features. So first one is gross features, which can be seen by naked eye, and they are heart is enlarged and increased in weight. And due to dilatation of all four chambers, heart look like a globe, and endocardium is thickened and walls are usually normal. Now microscopic morphological features. So there are no specific changes are seen under microscope. There are some changes, but they are not specific with dilated cardiomyopathy. So you cannot surely say that after seeing those changes that this patient is of dilated cardiomyopathy. So in under microscope you can see that some myocardial fibers are hypertrophied and some are atrophied. So this is all about idiopathic dilated cardiomyopathy. Now we will look at second subtype, that is idiopathic hypertrophic cardiomyopathy. So there are some other names also given to this, that are asymmetrical hypertrophy, hypertrophic subaortic stenosis, and Tier's disease. Now coming to its symptoms. So mostly it is symptomless, but sometimes symptom appears if a patient does heavy physical activity. And what are those symptoms? Those symptoms are dyspnea, angina, congestive heart failure, and even sudden death can occur. Dyspnea means difficulty in breathing. Again, coming to etiology of idiopathic hypertrophic cardiomyopathy. So similarly, here also causes are not known, but some causes, some hypotheses are proposed which are probable causes, not sure but probable. So what are those hypotheses? First one is there may be genetic factor involved, and second, there may be inherited mutation which you have studied just now, and there may be some other factors also, like increased circulating level of catecholamines, myocardial ischemia, or increased fibrous tissues in the myocardium. Increased circulating level of catecholamines. What are catecholamines? Catecholamines are hormones which are secreted from adrenal gland, and they have some effect on heart, like they increased heart rate, they increased force of contraction of heart, so they affect heart and they may cause heart damage. So they may cause hypertrophic cardiomyopathy. Now again we will look at morphology of idiopathic hypertrophic cardiomyopathy. Then it is already also divided into gross and microscopic. So what is gross features? Heart is enlarged and its weight is increased. Ventricles are normal or small. Remember this point. In dilated cardiomyopathy, ventricles are enlarged, but here they are normal or small. And there is hypertrophy of myocardium. And if this hypertrophy causes obstruction at mitral valve, it is called as obstructive, otherwise called as non-obstructive. We have seen above that hypertrophic cardiomyopathy is divided as obstructive and non-obstructive. So here is the explanation, that if it causes blockage as mitral valve, it will be called as obstructive, otherwise it is called as non-obstructive. Now coming to microscopic examination or microscopic morphologic features. So basically the myocardial cells are disorganized. The bundles of myocardial fibers are irregularly and haphazardly arranged rather than the usual parallel pattern, and individual muscle cells are hypertrophied. So the main feature, we will coming to main feature, that is myocardial cells are disorganized and they are haphazardly and irregularly attached. So you can see that from this picture. In healthy heart muscles, you can see that fibers are parallel arrangement, and in hypertrophic muscles the normal arrangement is lost, and there are some fibers are going upward, some are going downward, some are horizontal, some are vertical. So their parallel arrangement is lost and they are arranged in haphazard manner. So this is a characteristic feature of hypertrophic cardiomyopathy. So this is for today's lecture. In next lecture we will look at third subtype, that is restrictive cardiomyopathy, and we will try to cover rest of the topic. So that is it for today. If anything is not clear or not understood, you can ask in comment section. And for the till next time, take care. Bye bye.